Hello guys, this is Brian here with a video. Today is Tuesday, August the 15th, 2017. Got a good question for you. Do you think it's ethical for a health insurance company to seek a rate increase, then donate money to charity? Just think about that. Seeking a rate increase, so therefore you will be paying by force more money out of your pocket for 2018, but yet they're making donations to charity. Let me give you a little information on Blue Cross Blue Shield Texas, and I will lead up to what I'm talking about. For those of you who don't know, Blue Cross Blue Shield Texas is a non-for-profit tax-exempt organization, and they're owned and operated by Healthcare Service Corporation based out of Illinois, and they're tax-exempt non-for-profit too. So basically, Healthcare Service Corporation is the big mama, or the big daddy of everything. And they own 5 Blue Crosses in 5 states: Texas, Oklahoma, New Mexico, Illinois, and Montana. Those are the 5 Blue Crosses that they own and operate. And all these are non-for-profit, tax-exempt companies, which means they do not pay 1 cent in federal income taxes as a corporation, nor do they pay any property taxes at the local level. Any non-for-profit does not a tax-exempt non-for-profit does not pay property tax. I think more as a tax-exempt company does not pay property taxes. So that big giant campus that they have out in Richardson, Texas, which is not very far away from me, it's probably maybe a 30-minute car ride, maybe 20 minutes at the very most if you go down the turnpike. I think I looked it up. If I remember correctly, it's valued at $250 or $270 million. Not 1 cent on property tax. They don't pay 1 cent. So in theory of them being a tax-exempt, not-for-profit company, in theory, their premiums and rate hikes should be lower versus other insurance companies, for-profit health insurance companies such as Cigna, United, and Aetna. And Healthcare Service Corporation has been heavily criticized for having rate increases in premiums in line or above for-profit health insurance companies. According to the Texas Department of Insurance, as of December 2016, they're sitting on $9.5 billion with B billion dollars in net surplus cash. Well, as a non-for-profit tax-exempt company, they're not a public traded company because they can't be. They don't have investors. They can't. So where is that money coming from? It's coming from members' pockets. When you pay your insurance premium, that's where the money is coming from. And how can a health insurance company such as Healthcare Service Corporation in 5 states build up that much cash? So in reality, their rates are really unjustified, and the premiums are unjustified, are artificially high. Now, I looked on healthcare.gov. Supposedly, here in Texas, Blue Cross claims that they only made $8 million on the Obamacare plans, supposedly. But yet, they're non-for-profit, so therefore they shouldn't have all this extra cash. Now, in theory, now, by law, in most states, an insurance company does have to have a certain amount of money in reserves to make sure they don't fail, when they pay, they have to bring in money in order to pay out claims so they don't become insolvent. So they call it surplus. They have to have by law. But the problem is, Healthcare Service Corporation is going way, way, way overboard on this. Why are they sitting on $9.5 billion? That's almost, because they only, they operate in 5 states. That's almost $1.5 billion to $2 billion per state. A lot of money, and no one really knows what the formula behind what what should be the appropriate surplus is that I can find. But still, $9.5 billion for 5 states is awfully a lot of extra cash on hand. Where they got it? Well, they got it for the members, obviously. Well, according to healthcare.gov, on June the 2nd of 2017, they submitted a rate increase for 23% increase for 2018 for Texas on the HMO individual market. On June the 5th, according to Blue Cross Blue Shield Texas website, they announced a $10 million community investment program to help raise awareness around the prevention of early detection of chronic diabetic kidney disease and chronic obstructive pulmonary disease. And these community partners that they can partner up with can get up to $2 million a pop. And these community partners, these organizations, can apply for these grants. And in order to qualify for this money that they're doling out at the back door, they must have they must be non-profit, tax-exempt 501c3 organization with the expertise in chronic kidney disease and early stages of chronic obstructive pulmonary disease, tobacco-related illness, and tobacco cessation. The community-led organization must have the financial capacity and qualified staff to oversee and manage the project for this RFP, which I don't know what that is. Financial capacity as defined as organizations operating on a current annual budget of $2 million or more. The community-led organization must calibrate the proposed program with health system partners, such as hospitals, clinics, federal qualified health center, and so on and so on and so on. And they must collaborate on the proposed program outcomes with metrics and evaluation partners such as academic institutions, preferably a school of public health. Now, I've got a problem with that, big time. Now, let me start off by saying I do believe corporations should be a good neighbor to its community. However, a health insurance company such as Blue Cross Blue Shield, which is, like again, non-for-profit, tax-exempt, should not be doling out money. Because these community partners can help anybody off the street, so therefore it's not really, in reality, benefiting its own Blue Cross Blue Shield policyholders. So these people can help anybody off the street, uninsured, underinsured, people with Cigna, United, Aetna, whatever the case may be, Medicare, Medicaid, whatever the case may be. However, they're using the power of two regulatory agencies, which is the federal government and the state of Texas Department of Insurance, to get a rate increase for 2018, so you will be paying more money out of your pocket for a rate increase. By force, you have to pay it, unless you want to go without insurance. And then, where's this $10 million coming from? Well, it came from people's pockets. The members' pockets. So, in reality, it's very inappropriate for a health insurance company to use regulatory agencies to get a rate increase, then donate $10 million to charities. Very inappropriate to do that. Simply because you have to pay, it's coming out of your pocket by force. They will get their rate increase. Now, Blue Cross is requesting 23% rate increase for 2018. Will they get it? Yes. They could be getting a little bit more, could be a little bit less, but they will get a rate increase. It is guaranteed that they will get one. But supposedly, the reason why they're asking for the rate increase is because supposedly Blue Cross only made $8 million here in Texas on the individual Obamacare plan market, supposedly. Which I do question that because Healthcare Service Corporation is sitting on $9.5 billion in net surplus cash. So, if they only made $8 million, supposedly, why are they giving $10 million out? So, in reality, they are going in a negative $2 million in negative, supposedly. Now, that's just on the individual market. Who knows how much money they make on the group side? No one really knows how much money. But I found it very inappropriate, questionable. Even the timing looks bad. June the 2nd was a Friday. They submitted their rate increase. June the 5th was a Monday when they announced this, and I'll post all the links to this. And you can make the argument the two things may not be related to each other, and that could be true. That could be true that this program could be in the works for a year, and the rate increases could be in the works for a couple months. That could be true, but still, it's still inappropriate for a health insurance company to make people pay more money out of pocket, because every insurance company in America gets rate increases year after year after year after year since the 1970s. So it's still inappropriate for them to make people pay more money out of pocket for premiums and donate money to charity. It's still inappropriate to do that. Even though the two are not related to each other, the timings of those two may not be related. And probably the average person maybe pay maybe $5, $10, $20, $30 extra per year where this $10 million came from. Now, what I do think would be a good idea is if Blue Cross Blue Shield put this $10 million aside and say, hey, it's for our members who have these two diseases that are in a financial bind or hardship, that cannot afford treatment, co-pays, premiums, deductibles, what have you, and that benefits its own Blue Cross Blue Shield members. I think that would be a good idea if they did that. But it's not right, because of them donating to all these charities, partners, whoever you want to call them, blindly, really, it's not benefiting the system. It's not benefiting Blue Cross Blue Shield policyholders, really. So basically, they're just taking money from people and doling it out as a charity, and that's very inappropriate to do that, especially a health insurance company. Because your premium, when you pay, it's supposed to pay out claims. You know, it's there to pay out the claims to the providers, such as hospitals, doctors, pharmacies, and what have you. It's supposed to go into the cost of the insurance company, administrative cost, postage, paper, office supplies, people's salaries, and things like that, and their benefits. But I'm questioning, since they're non-for-profit, tax-exempt company, I think they're hiding behind that, so therefore they don't have to pay any taxes anywhere. But like I said, it's very inappropriate. Get a rate increase and then donate money to charity. It's just very inappropriate to do that, because in reality, how can you really justify a rate increase to begin with then? Because you're saying that we must have more money to pay out claims. Well, not really. If you have $10 million sitting around, why is that $10 million not being used to pay out claims then? Why is that $10 million not being used to reduce premiums then? So which is it? They want it 6 races Sunday, but in reality is they take the money out of your own pocket, go into the insurance company system, and then donate money at the back door to charity, to this program. Very inappropriate. And then if I was a doctor, I'd be pissed off too. Nowadays, independent doctors, they're not connected with a big old healthcare system, hospital system. They don't get paid very much anymore. And they really can't negotiate with the big insurance company nowadays. And, their reimbursement's going lower and lower and lower nowadays. So if I was a provider too, I'd be pissed off too, because if the insurance company is claiming, well, we have to lower your reimbursement rate because we're not getting very much money from premiums and all that junk. Well, yeah, you are, because you get $10 extra to dole out. And $10 million is a lot of money. But I think they do hide behind the non-for-profit tax-exempt status, so they don't pay no property taxes or anything like that, nor federal income taxes. And I think it's about time federal and state regulators need to look into that and yank it away from them. That's what they did in Blue Cross of California. They yanked away their tax-exempt status because they were hoarding money. Because, as a non-for-profit tax-exempt organization, you're supposed to be benefiting the community. Well, Blue Cross is not really benefiting the community, really, in reality, because the only benefit that arises from this is hiding money. That's all it boils down to. I think that all this tax-exempt crap that they hide behind, it needs to be yanked away from them. Because they are acting like a for-profit company. They are acting like a for-profit health insurance company. And who knows what the rate increases are for non-compliant ACA plans, if they have any more left nowadays, or large employer plans are not compliant, or whoever, because they do submit that to the state of Texas, and unless you call them and find out, or you don't, if you don't, you don't know, where's all that money flowing to? But I just find it very inappropriate for a health insurance company and make people pay more money out of the pocket for premiums. And then, ever since Obamacare kicked in, everybody's deductible went up through the roof, and co-insurance went up through the roof, and co-pays and all that. But yet, they got $10 million sitting aside. That's what pisses me off to no end about that, too. It just really aggravates me about that. Because I'm sure I will get a letter sometime in October, month after next, or November, somewhere around there, saying, hey, your insurance premiums will be going up. Let me see if I had a thing from Blue Cross saying how much my premium is. I think my premium without the subsidy is $350 or $370 without the subsidy. With the subsidy, it's around $175. Yeah, $175, $79 I pay. Which, I'm not complaining about that. That's a pretty good deal. But still, if you don't take the subsidy, are those premiums are really artificially high to begin with, because the insurance company know they're going to get the subsidy? That's a good question. Because before Obamacare on our group plan, we were getting up to 300s. In 2013, before all the Obamacare disaster hit, we were getting, I remember that year it jumped up high. But like I said, was it designed for them to jump up that high because they were getting a good subsidy? I think so. Because I even checked with Blue Cross, if you don't take out the subsidy, their premiums are very expensive. Also in line with Cigna, United, and Aetna. But I just find it very inappropriate, like I said. In reality, I don't think Blue Cross really has the right to ask for any kind of rate increases, because they got $9.5 billion in net surplus for 5 states. And you can make the argument, well, if they have all this cash, why are they seeking rate increases? And also, they've been criticized, the CEO of Healthcare Service Corporation, I think her name was Pat Hemingway, the old CEO. I think she came from Texas, and then she got in the Big Daddy Healthcare Service Corporation. I think they paid her when she left retirement, I think $10 to $15 million. Once again, where's that money coming from? Members. I think they hide behind that too, being tax exempt non-for-profit, because I don't think they had to report that versus a public traded company. I think they had the executive paid behind that too. Because that was reported to the media. But this video is long enough. But just post your thoughts on this. Like I said, using the regulatory agencies to get a rate increase, but donate money to these charity program. Very unethical. Talk to y'all later.